Good morning, everybody. We're just on 12, or good afternoon, I should say. We are just on 12 o'clock. We have quite a number of attendees on today's webinar, so we're just going to give it a couple of more minutes to allow everybody to get online, and then we'll kick off. So just bear with us for a couple of minutes.
Hello and welcome to today's webinar. My name is Gemma and I will be your moderator today. Before we start, let's take a moment to ensure that everyone is ready and familiar with the webinar control panel. First, you should have a control panel on the right side of your screen. You may minimize this panel by clicking on the double arrow button in the upper left corner. You may expand the panel by clicking the same button. Take a moment to practice. Second, you have the ability to submit questions using the chat pane located near the bottom of the control panel. Throughout our presentation, we encourage you to interact with our speakers by typing in questions and comments using the questions pane. We will be answering questions live both during the event and after the presentation. We're recording today's session and we will be making the link to the recording available 24 hours post-event via email. We also encourage you to forward a copy of today's webinar to any coworkers you feel might benefit from the information presented during this session. Without further ado, I would again like to thank you for attending today's webinar, and I will pass you over to our presenters for today's session.
Thanks, Gemma. It's Mark Winter here from inTechnology Distribution, and I also have Bob Kennedy from AiRISTA. Unfortunately, ironically, we actually have, we had Dylan, who was going to be joining us today, but he unfortunately has ended up in hospital. So not necessarily prevalent to what we're talking about today, but we wish him all the best and hope he for a speedy recovery. I wanted to start this morning this afternoon by just doing a quick introduction video around AiRISTA and some of the deployments that we've actually done. So just bear with me, I'll just get this video started.
I'm here today at the Discreet Hospital and I want to tell you a bit more about our latest deployments, and I also want to tell you a little bit about AiRISTA. We are a global leader when it comes to achieving business process improvements by using real-time location services, also known as RTLS. And with our technology, we can achieve unprecedented location accuracy by utilizing the existing Wi-Fi infrastructure. We are the preferred vendor for many New South Wales local health districts, and the Discreet Hospital is one of our latest deployments.
So we're here today in the new IPU department, which is opening to the public in the next couple of days, where we've been deploying AiRISTA's RTLS system. For this particular hospital, the use case has been Mobile Duress, where they've been utilising the AiRISTA B4 tags, where the staff have got the capability to either press a button or they can pull a safety switch in order for security and nearby staff to come and assist in the event of a duress situation. From a technical perspective, there's 3 different phases that we follow to ensure that we have a successful RTLS project. So the first phase requires a predictive Wi-Fi survey, where we take a model of the map of the different floor plans of the site here, and we place access points on the map to ensure that we've got enough access point and Wi-Fi density to support the RTLS system. The next phase requires an engineer to come on site with a specialised piece of Wi-Fi capture hardware and the engineer walks through different areas of the hospital, capturing that Wi-Fi infrastructure and to ensure that we got the predictive model correct and that the access point density and the placement is correct as well. We then provide a report to stakeholders to show that either the Wi-Fi environment is optimal for RTLS deployment, or there might be some areas that need additional tweaks, or some access points maybe need to be placed in a different area. And the final phase is where we're at now, where we're doing the RTLS calibration. So we walk through the facility, similar to the Wi-Fi validation phase, but we're using the AiRISTA tags to calibrate the wireless environment.
Our software also allows us to collect location information from all sorts of technologies like Bluetooth Low Energy, GPS, passive RFID. So in that sense, our software is technology agnostic, which we also see as a major driver for the healthcare industry in the future, to provide operational excellence for use cases like orderly management, asset management and utilization, hand hygiene compliance, wandering patients, and many, many others. In Australia and Asia Pacific, we are working very closely with inTechnology, who is not only our exclusive distribution partner, but also a team of very skilled experts to provide added value and technical knowledge around RTLS and wireless services.
So inTechnology engineers can help improve and optimize the RTLS deployment phase based on the suite of tools that we distribute and sell to the channel, as well as our expertise ourselves. So we have a lot of hands-on experience, a lot of cases we represent the vendor in country, and that goes from an end-to-end deployment phase. So we've worked on the predictive, we've worked on the validation, we've worked on the RTLS deployment, and we've done that across multiple different sectors. So not just healthcare, but we've also done that across local city council. We've done that in education. We've also done that in industrial applications as well. So we've got a lot of expertise in different areas that allows us to achieve an optimal outcome.
Get in touch with us and discover what we can do for your company.
All right, now we're past all the fun stuff. We'll get into the presentation. So let's look at the agenda that we've got today. So I'm going to do a little bit of an introduction to inTechnology and who we are. We'll talk a little bit, obviously, a lot about AiRISTA Flow. We're going to delve into the issues around staff safety and really how we can improve the response to staff safety when a staff member is actually in a duress type environment. We'll talk about the technology. We'll talk about the back-end infrastructure. So we'll talk about the AiRISTA Flow UVS platform and how that assists. And then we'll also discuss some of the popular other health use cases that we use AiRISTA Flow's technology for. And obviously at the end, we'll have a Q&A session. So any questions, as Gemma mentioned at the beginning, any questions that you have, feel free to type them in the Windows pane and we will answer them as we go. And we'll certainly, as we mentioned also, we'll be recording this, or we are recording this webinar, so you can pass this on or watch this at a later stage if you need to. So a little bit about inTechnology. We've been founded in 1999, so we've been around for about 2 decades. We've got offices in Sydney, Melbourne, Gold Coast, and in Manila. We really focus in and around the RTLS, Wi-Fi, BLE, and services around those technologies. And we basically, what we do is we provide products and services directly through to our channel partners. So we're very much we are a distributor, and we're a value-added distributor. So what you see today, you would never purchase directly from us. It would always go through one of our reseller partners. But yeah, just letting you know that that's our business model and how we basically work. So some of the technologies or some of the solutions that we can provide in conjunction with our channel partners is obviously technology introduction workshops. So it's taking what you'll see today, but putting into more of a formal setting to understand more around what your specific requirements are and then how we can help. Requirements analysis, obviously, we look at business process mapping. So if you've got business processes that you want to be able to integrate into an RTLS deployment, then we can work with you on that. Vendor selection and engagement, project and resource management. I'm not going to go through all these, but I just want to give you, we wanted to give you an understanding in relation to, some of the services that we provide through our reseller partners for customers like yourselves. Bit of background about AiRISTA Flow. AiRISTA Flow develops and manufactures RTLS technology. So passive RFID, active RFID, semi-passive, GPS, BLE, Wi-Fi, and also others. As technology evolves, they'll also be developing technology to keep up with where the market is going. They are headquartered in Sparks in Maryland. They basically, their main US operation is based out of Reston, and they have international operations. In Australia, mentioned earlier on that Dylan was going to be on this call. Unfortunately, he's not well. He is based here in Australia. They also have offices in the UK, and also supported from the original area where they were found, which is in Helsinki in Finland. They've been around since about 2008. They've been working in the healthcare, aerospace, oil and gas industries. And then in March in 2016, AiRISTA actually acquired Ekahau's RTLS business, which then established the AiRISTA business. So I'm not going to go through a great deal of detail in relation to AiRISTA. You can see it on the slide there, and obviously we'll give you a copy of the slide deck. One thing I do want to point out, this is the Gartner's Magic Quadrant for indoor location services. This is the second year that Gartner has actually held this or run this quadrant. And as you can see, AiRISTA is in the top of this year. I should have had the other image of last year as well, because they were in a very, very similar position, maybe a little bit lower, but they're now getting higher in that Gartner Magic Quadrant. So the big question is that why are we here today? Why do we have so many people from so many different areas across the country on this call? And I do appreciate you all being here, by the way. We know that your time is valuable. We want to make sure that we can give you enough information for you to make an educated decision on the things that you can do to actually protect your staff in your facilities. So we wanted to give you an idea as to why we're here. And I'm just going to play a quick little video, and it'll give you an understanding as to why this is so important.
Battered and bruised while just doing her job.
Very unexpected, unprovoked. Yeah, they just hit me in the head at least a few times.
ED nurse Amanda Triggers bravely spoke to shine a light on the dangers faced by hospital staff.
Emergency workers and nurses and doctors, we're there to help people, and this just shouldn't happen.
She was treating the young patient on Monday when he lashed out.
I had no time to defend myself or do anything. I started screaming and yeah, they kept hitting me.
There is an absolute problem across the board. We don't believe that the issue of violence and aggression is taken seriously enough.
SA Health says staff safety is paramount.
We could have all the security, but an unforecasted event or unpredictable behaviour does occur.
Police have confirmed an 18-year-old man from Eyre Peninsula has been charged with assault and bailed. He'll front court next month.
I think there needs to be a look at staffing and security.
It's the second serious assault in 2 months. In June, a nurse was stabbed in the neck during a random attack outside the Lyell McEwen Hospital. Deanna Williams, 7 News.
We don't show you this to try and sensationalise the issues that we face in today's age with the violence that we're seeing in hospitals. We do that really just to give you a clear understanding as to why we are and why there is such a need, for this type of technology, and for organisations like yourselves to ensure that you're protecting your staff within your facilities.
Battered and bruised.
So, as I said, this obviously staff safety, it's a real issue. And I'm not going to go through and read these slides. As I said, the key things we want to look at, we're all about saving lives. Every year there's additional exposures that staff are facing. Obviously, we're seeing a lot of drugs, and people coming in drug induced into the ORs and into the facilities. And it's not just in an OR type environment as well. There's been recent incidences where they've actually been in mental health wards, as an example. Workplace health and safety really is a key thing, and keeping your staff safe and the staff knowing that they're safe is absolutely paramount. The video that we showed you, we weren't picking on any particular facility or any particular state. This is across the board. This isn't an issue in relation to the healthcare system isn't doing enough. The issue is that we need to do more, and the reason being is because we're facing greater risks as we move forward. So, keeping staff safe is very important. And it's not just staff, it's also patients. There was a recent scenario in one of the facilities where one patient was attacked by another. So, although we are talking specifically today about staff safety isn't just the only thing that we need to look at and address when we start looking at safety within healthcare. Again, these are a couple of articles that we pulled out. One from February, one from July, and really, so what we really want to talk about is really how the AiRISTA Flow technology actually addresses these issues and the value that it actually offers to an organisation, a healthcare organisation. One of the biggest things is when a staff member or a patient is being put into a situation where they do require a duress or a mobile duress call, the important thing is to actually know specifically where they are, and then specifically the specific location, so that a security advisor or a security guard knows exactly the location they need to get to help and rescue or save that person from imminent danger. So the idea is basically what we're seeing on the screen here is the AiRISTA Flow B4 tag, and I'm hoping that you can potentially see the writing on that tag. It actually does indicate specifically that there is a code red in room 30. So what we're able to do in a duress situation, and you would have seen it in the video that we showed initially, when somebody does get into a duress situation, what they're able to do is they're able to pull the tag, and that will actually then set a duress alarm back to the system that will then notify specific people or specific badges that are in that same vicinity as the person who's in duress, that will then allow them to go and send security to go and help that person. Now, whether that's to send security or whether that's to send another staff member, to that specific location to actually help them. The other things that we can do is we can do things like we can send email alerts to specific locations. We can send messages to mobile phones. We can integrate systems or integrate the system into your nurse call, as an example, or your security systems or your camera systems. So very, very flexible, very, very versatile technology that we're talking about here. And a technology that is, as we mentioned was mentioned in the original video, this is not a new solution. This technology is being deployed across the bulk of the New South Wales health facilities today, and a number of other states are also deploying these. So very, very important to make sure that you've got something like this, this type of technology deployed within your facility to help protect your staff. I'm going to drill down a little bit on the staff duress. So we mentioned before that when a staff member gets into a duress situation, they're able to, this in some cases will hang as a lanyard around someone's neck, or alternatively, it will actually hang on their belt as a belt clip. So when they get into a duress situation, they pull the tag, and that will actually alight or alert the staff and the security around their location. We also have built into this a tilt and an accelerometer. So in other words, if somebody is knocked unconscious, as an example, and they don't have the ability to actually pull the duress, the tilt will actually give man down functionality, so that if somebody is in a scenario where they are knocked out and they're not able to pull the duress tag, the tag itself will actually communicate back to the system to let them know that there is somebody in a duress situation. The LED lights basically allow you to know that the system is actually active and on the network. The buttons that you see on the front here are programmable. So as an example, you may decide that you don't want to have the pull cord. You may want to use the red button. In other words, if you hold the red button down for 2 seconds, it might send an alarm. So it might, do that in a silent mode, as an example. The LED display provides you with the functionality of actually being able to do two-way communication messaging to the tag. So as an example, when we talked about the man down functionality, if the tag is actually laying flat and that a person has actually been knocked out, as an example, we will send a message to the tag to say, "Are you okay?" Now, if that person doesn't come back and say, I am okay, it was a false alarm, then we will then send a message to then send a staff member or a security member to go and help that person. So it gives you that, that additional functionality that confirms whether that person is in an okay situation or is not. And then down the bottom here, all these tags are actually rechargeable. You're going to get about 12 to 16 hours of charge within these batteries or within these tags. So certainly does, when you're looking at a shift in a hospital, will certainly do at least a shift, you know, for that nurse or that healthcare worker. So the staff safety use case, really what we're talking about is the problem that we have is whether it be psychiatric intoxicated patients or patients that just for some reason go off the edge and determine that they're going to do harm to somebody else. In the situation that we're talking about here, what will happen, as I mentioned before, so the staff member will pull the duress. The duress message gets sent to either the AiRISTA UVS application or the Vision software, and Bob and I will talk a little bit more about that in a second. And it then notifies the staff that are actually within a specific vicinity of that particular tag, or alternatively the security staff, which then allows them to go and look at the location as to where that person is and go and help them, as I've mentioned before. Very, very simple rule implementation. You know, one of the things that AiRISTA has been very, very good at, and one of the reasons that it is the #1 mobile duress solution being deployed in this country and across the globe, is the fact that the rules are basically very, very easy to set up and configure, and also the tag functionality, the man down, as we mentioned before, you know, is something that has been was actually developed specifically for one of the large institutions here, and then was actually rolled out across AiRISTA platform across the globe, because that was one of the requirements that we had down here. I mentioned before, so this is an example of where a nurse has actually pulled a duress, and we can actually see exactly within the facility where that duress tag was actually pulled. So we can see that it's actually in this room here. So if I'm sitting at the security desk, I can actually see exactly which room that nurse is at, or that staff member is at, and I can go directly to that location and help them. We can also do a forensic replay. So as an example, we can look at the location history of a patient or of a person, and then we can actually play that back. So we can actually see exactly where they've gone and what's actually happened during the course of a duress type situation. So what it does is the AiRISTA UVS platform gives you the functionality to be able to do an instant replay of the location. So you've then got a history of what happened, and you can also then put notes into the system to say a duress was actually called in this location. This was exactly what happened in that situation, and then that can then get logged and then used for any reporting that you need to actually report back to, obviously, to the health department or the you know, the facility in and around what actually happened during that duress scenario. The other part to the UVS platform, which is really powerful, is that it allows you to have either a single view or a multi-view, depending upon your location. So you can see here we've got the floors of the location, so the floors of the hospital, and you can actually drill directly into that, and you can see exactly the location of any of the staff members at any given time, if that's what you would like to do. Certainly when it comes to a duress situation, it's very important to understand and know exactly where that person is when it gets to a situation that they're in a duress scenario. Some of the dashboards that you can pull out within the UVS platform, we mentioned before, we're going to talk a little bit about the system itself as well. So this is actually in the last few screens you've seen has been the UVS platform. And what we're seeing here is we're seeing the location and, you know, the nurses who have actually got, nurses and doctors who have got the tags, and we can also then look at the last known location of where they are. Obviously, there's going to be some of them in here that actually aren't on shift right now. You know, we could drill down into these and then if I go back to that previous slide, it would then pull up where that nurse or that doctor is if that's required. The RTLS, as we mentioned before, UVS is really an RTLS, it's an enterprise grade solution. So it's not just about, we don't just look specifically at mobile duress. It cuts across a multitude of different application usages. And what you can see on the screen here is giving you a little bit of an understanding in relation to what some of that looks like. You can see there's a lot of data analytics and data mining that you can do within the system. So you can potentially have the system set up so that you can actually look at all of the duress issues or duress calls during the course of the day, the month, the year from a specific department. You can look at it from a hospital perspective. For most of our facilities where we're running, or most of the LHDs as an example, they have multiple facilities that run under them. They can look at it from an LHD perspective, and even going further into the enterprise grade scenario is that they can also look at it from a statewide situation. So as an example, if I'm a health department and I want to look to see how many duress calls have I had in the last 48 hours or the last 2 months or whatever it may be, I can drill down by hospital, I can drill down by department, and I can also give that access to the department or the hospital, depending upon which way or how you would actually like to deliver that content out to the facilities as well. So I mentioned before, some of the things that we talk about in relation to the samples. So you can see down here, this is a hand hygiene compliance screenshot. So the application usages for this technology, it goes further than beyond just looking at duress. But I wanted to give you an idea in relation to the user friendliness and view of the system itself. It really does give you that true business intelligence that you actually need and need to be able to analyze trends as an example. So you might say that, we all know that Friday and Saturday night can be a lot more manic in an emergency department than say a Tuesday at 2 o'clock in the afternoon. So it can really give you real-time analytics and interactive feedback in relation to, well, we know that we're going to have more staff on, within the ED, within a certain area of the ED, on Friday and Saturday night. We know that we've had, 7 duress calls on Saturday last week. Or historically, we've seen that we're getting about 7 or 8 a night. We only have 1 security guard on. Well, 1 security guard isn't going to be able to manage 7 duress scenarios. So having this historical information and looking at and analyzing the trends is very, very important. So if we look at the UVS solution that we're talking about right now, the UVS technology doesn't just work on it's not just a single solution. It's a multifaceted solution, as I mentioned before. So we talked about in the initial introduction, we talked about the different technologies that the AiRISTA Flow actually has developed and develops through the UVS platform. We can monitor and track barcodes, passive RFID, active RFID, obviously BLE, Wi-Fi, and ultra wideband, GPS, smartphones. You'll see smartphones that are in the market today that we want to be able to track those. We can also track third-party hardware and third-party software. So for some of the facilities, I can see from, and I know some of the people who are on the call, so this is very relevant to them. There are some of the organisations that are on the call today that are using Honeywell phones, they're using ASCOM phones. So obviously we're able to track and monitor those phones as well. With the duress buttons that are on top of those phones, we can actually then integrate this into the actual AiRISTA Flow system. So we look at the data collection side, as I mentioned before. So what we're doing is we're gathering data from all these devices and then putting it through the AiRISTA Flow data collection engine, and then pushing that through to the location engine that has the business rules built in, has the real-time messaging and has the track and trace. And then what we're then doing is we're taking that information and then we're actually taking an action on it. So we might want to push this out to a web service or a web application as an example. We also want to make sure that we mentioned before that we're going to be tracking and managing the analytics on dashboards. The notifications and alerts, really important, to be able to know where somebody is, and also just to have notifications that are historical, as we mentioned. We can also do things like, push that information out to an access control system. So as an example, if I want to have, excuse me, if there's a duress situation that's in the emergency department, but my security guards are on the other side of the door, we want to be able to activate the door to open when a security guard gets close. So we can automate that by tying that into building management systems as well. And I can see there's a couple of questions already, and one of them is specifically around the building management system, and I'll pass that to Bob as we move forward. Again, just in relation to the questions, any questions, feel free to put them in the chat window, and we'll answer them as we go. The other part to the AiRISTA Flow product is that we can also push this back to third-party solutions. So whether it's going to be used within the AiRISTA Flow application itself, or you want to be able to push information that we're gathering from the AiRISTA Flow solution, like I said before, to an access control system or third-party solutions, we can obviously do that as well. When it comes to the topology and how do we deploy this technology, so the technology really can be deployed on a bed level. So we can basically have it so that we're tracking a bed. We can have it that we're looking at the door level. We can look at room level accuracy. We can look at building level of accuracy, and we can also look at multi-campus. So when I mentioned before, we're not just looking at one type of deployment topology. The topology of deployment is across the board. So whether it be a complete campus that you're looking to track, whether it be building level, room, door, or bed level. So with the functionality of the AiRISTA Flow product is so advanced that it allows us to track all. Bob, are you there? I might get you to run through this slide if you're there, Bob.
Unmute. I am. How are you?
Good.
So do you want me to go through it from the use cases or from the technologies?
Let's go through from both.
Okay, well, from a technology standpoint, one of the UVS platform is more of a, while we provide the RTLS for Wi-Fi and BLE, it is able to surface data from other types. So those types would be RFID, which is your classic passive components you may have on devices. Typically low value assets or sometimes patients. BLE, which is Bluetooth Low Energy. It's kind of the next generation of where your access points and things are going in addition to Wi-Fi. It provides a little greater granularity and a little better price point in battery operations. And GPS is global positioning. So these tags are available with GPS capability in them, outdoor use, things like that, where there's vast areas that would be available. However, the core is the Wi-Fi tracking within it and utilizing the existing infrastructure or augmenting it for any of these technologies, which would be readers for RFID, little beaconing devices for BLE. And then having those available in tags and software platform to support asset tracking, your patient safety, duress, the workflow optimizations, patient throughput. We do a lot with temperature and humidity, and as you mentioned at the very beginning of the thing, hand hygiene compliance.
Excellent. And
kind of address what you're looking at.
Yeah, you made a really good point in relation to the temperature monitoring, and this is something that we're starting to see facilities are really looking at deploying or are deploying now, to protect the the research or the drugs that are in those fridges. So you make a really good point in relation to that. Thank you.
Good.
So I wanted to go through a very high level, in relation to what does a system look like. So really you've got four components of an RTLS deployment. You've obviously got your devices. Now these can be Wi-Fi or BLE, as Bob mentioned. You've then got your Wi-Fi network or your BLE network, depending upon which way you decide to go, or it might be a Wi-Fi and BLE network. Within the system itself, you've got the RTLS server, what the RTLS server is, it's the brains of the system. It's how we how we're differentiated between us and other competitors that are in the market. And what I mean by that is, one of the big differences or one of the big advantages with AiRISTA Flow is the location accuracy that AiRISTA Flow gets is higher in granularity than any other provider on the market. And the reason being is that they use a thing called a probabilistic algorithm to determine the location and to calculate the location of devices. Now, a probabilistic algorithm is actually, as it sounds, it's a mathematical equation. So right now, if you think about your GPS coordinates, where you're sitting in your chair right now, you have a specific GPS coordinate where you're currently located. Very similar to how we work with the AiRISTA flow and how the probabilistic algorithm works. We make a determination when we go and do a deployment. It was mentioned in the video originally, we go out, we calibrate the system. In other words, we teach the system, what the location or where the location is. So that's why we're able to get the granularity. We're able to get room level accuracy. So, we know that Mrs. Jones or Nurse Jones is in room 13 as opposed to in the corridor or somewhere between room 13, 16, 18 and 14. We're able to give you that granularity in relation to the specific location of where they are. And then the fourth part of that is the AiRISTA Flow UVS platform, which is what I mentioned, which we mentioned before, which was the giving you that the data analytics and being able to allow you to visualize that, and that's where the reporting and that's where the alerting is coming from, and the rules are being built as well. Perfect time to ask this question. Actually, I've got a question here, Bob. The question is. BLE or Wi-Fi for RTLS, what would you do? Do you want to grab that one?
Sure. Both can be used for RTLS. The idea of BLE would be maybe a dominant solution in a high number of tags or assets or people and a smaller area, or Wi-Fi where the infrastructure already exists. We will tell you, you should go both and start looking at it, because it is the future and the direction. Your next generation of Cisco and Aruba and most all of your Wi-Fi vendors are coming out with hybrid Wi-Fi and BLE. We, for the last few years, have been producing hybrid Wi-Fi and BLE tags. So from that standpoint, everybody's protected into what they'd want to do. And we would tell you that, ride the flow. BLE is a very low energy, great way to augment a Wi-Fi network. And as it progresses, it's offering some very promising things for longer range and outdoor. But its big benefit is it's very low energy and very low cost, and it's coming to you regardless in your infrastructure.
Yep, that's great. Thanks, Bob. I've got another one, another question here. We might as well keep the questions going. Is there a facility within the software suite for an end user to self-test their devices before they starting the shift?
Is that for me?
Yes.
Absolutely. The system is set up with zones and the buttons on the tags, and the buttons can have different zones. In fact, many of our clients, state of California is a great example. When they step onto a campus, they're required to test. They hit a button. I think in their case, it's the red button in a specific zone, and it runs through the process, but does not set off all the alerts, just validates it and comes back to a message to the tag telling that it's fully functioning and online. So those are things that can be set up on any site with the existing, what's comes with the core product.
Yeah, and it's certainly something that we see quite often within New South Wales, where there is that requirement, and also a requirement to actually log that tag has been tested. So
correct.
They know
correct.
that has been.
We strongly recommend it. It's a safety device. Why not validate it? It takes
absolutely
a second and hit a button.
So we mentioned before BLE, and BLE is one of the technologies that we're starting to see is really being used a lot more within the healthcare industry, or a lot of industries in actual fact. And one of the things that AiRISTA Flow has been very, very good at is being ahead of the curve when it comes to to this technology. And I think we'll see some more BLE infrastructure coming out from AiRISTA Flow and in the next sort of 6 months. But Bob mentioned before, one of the things we're seeing BLE being used a lot for asset tracking. So as we move forward, we'll certainly start seeing a lot more of BLE, and you'll more than likely be your providers, and whether it be whether it be a device like an asset that you want to track or whatever it may be, you'll start seeing BLE being one of the things that that is really being pushed.
And there can be great synergies among BLE if you're looking into wayfinding or things like that. That the infrastructure that's placed there would augment any Wi-Fi infrastructure that comes with BLE or anything else that is used in that model. They're just very synergistic. Absolutely.
So I was mentioning before the deployment scenarios. So for those that are in a large type environments, what you can see here, we've got site one that is potentially a duress or a scenario where you've got a duress situation. What we want to make sure when we're going into a duress environment, we want to make sure that we actually we have a server that sits on the site. So you can see we've got different sites here. Site one really is probably an asset. It would be an asset tracking site. In other words, what we're doing is we've got the UVS system sitting in the data center. So they're redundant. If one goes down, the other one pops up. And then site two, we've got site two with high availability. And the reason that we do that is that if there's ever a link, if the link is actually ever down, we need to make sure, and we have to make sure that, if there is a duress scenario, that we have 100% uptime. 99.9% isn't enough, because that 0.1% chance where there is a duress and the duress notification does not get sent. So in that sort of environment, we'll actually have a server that will actually sit on the site and then talk back to the AiRISTA Flow UVS platform that sits in the data center. And you can see there's different topologies, depending upon what is required. The other area here we talked about before, so you've got third-party systems that we talk to, whether that be security systems or whether that be building management systems, whatever it may be. And then over here, you've got your supply chain workflows, you've got temperature monitoring we do, your EMR basically will sit across the side of that as well. And again, everything that we do is we then talk back to the web-based UVS application. And that's where we give the real-time notifications and real-time alerts and we schedule the reporting and things like that. There's another couple of questions here, Bob. Can you just expand a little bit more on the building management systems and which building management systems we're currently working with?
So currently when people look at building management systems, we're looking at it in two areas. Usually it's security. I want to lock down or do things like that. But we also do see it where it may be environmental monitoring with temperature adjustments and the like. Most of your building management systems are supported. JCI, Honeywell, Siemens. There's a pretty common building control interface called BACnet, all of which can be used, and others just as we come. Those are just some of the major building control operators, all
right.
supported.
I've got another question here, Bob, if I can. Can AiRISTA do outdoor RTLS in a situation, I guess the scenario would be in a situation like a car park?
We certainly can do outdoor. There's a couple of ways in which to do it. Typically outdoor, we would recommend a little less granularity since you have long line of sight. The most common area for doing that is with some sort of Wi-Fi or BLE augmentation through the building. GPS is a little bit defeated if it's a multi-story car park. Open lot, that's another option. Actually, that's a pretty good option also for outdoor Wi-Fi extensions. But anyways, via Wi-Fi being placed outdoors, BLE being placed outdoors, and GPS, it could be supported. It would depend on what's best for each individual environment. Obviously, vast areas, GPS is a preferred solution. Smaller areas, it might be just as affordable and easier to control with Wi-Fi or a BLE add-on.
Okay, great. Another question is there a limit to the amount of tags that can be within one facility? Obviously running over Wi-Fi, let me just read this. Obviously running over Wi-Fi, let me just try and reword this. What the question is really saying is there a limit to the amount of tags that can be on a Wi-Fi network, or sorry, can be run over their Wi-Fi network? And does it actually interfere with their other Wi-Fi infrastructure that they're currently working with?
It would depend on the total number. For asset tags and the like, and most location is done in a blink mode where there's really not much of a limit. In fact, we'll tell you the base server configuration is configured for 20,000 tags in a facility. When we are doing messaging and some of the others, those are associating and becoming part of the network when they are associated, but typically we're looking at hundreds to maybe 1,000 of those, and that's only when there's a message. So a duress would be a very infrequent thing, but it could be used for other messaging. But as a whole, it should have very, very little impact. When we do what we call a blink, it's gathering location data without associating to the network. It's really in the preamble to the connection. It's called the level 2 integration, where it's going up and the system is handing it its info without making the tags go through it. So it's very efficient for batteries and very, very efficient for your network traffic. Your numbers are in the high tens of thousands before you should be concerned.
Great, thanks for that. One question that I guess I wanted to ask you, Bob, and sorry to put you on the spot here, mate, but from an overall, from a global standpoint, and what you're seeing in relation to duress across the globe and the requirement for duress across the globe, what is your recommendation in relation to what an organisation put in? Is it BLE and Wi-Fi? Is it just Wi-Fi? Is it what's your recommendation?
I think some of that depends on what's in an individual facility. Some modern state-of-the-art Wi-Fi can easily handle it in Wi-Fi alone for most use cases. However, BLE is the trend. As it evolves, it's more and more exciting. It's cheaper. It gets cheaper and cheaper. As we look to the future and what's coming in 5.1 and longer range and greater accuracy requirements, I think the Wi-Fi BLE is a hybrid. You're doing something that's very efficient today and future-proofing it for a very nominal cost difference by having Wi-Fi and BLE capable tags.
Yeah. Okay, great. Excellent. Look, we're not too far off. We've got a couple more questions that are coming in. I think we can probably answer those offline. They're more specific to a specific opportunity that we're currently working on. I guess the other thing I would like to update everybody who's on the call, we do have some additional upcoming webinars. I don't know whether you can see this very well. It looks a bit hazy on my machine, but we've got some other upcoming webinars that's going to be focused on asset tracking, senior living, hand hygiene compliance, and also temperature monitoring. As part of what you will receive after or post this webinar, obviously you'll receive the recording, but the other thing that we're going to do is we're going to send you a copy of this slide deck. And the reason being is that on the back of this slide deck, we have a whole bunch of different use cases where RTLS is being used in a facility. So obviously today we're talking specifically about the mobile duress, but there's a whole bunch of different use cases for RTLS. And I think one of the things that we would really encourage you as we move forward is to look at, what other use cases are there within your facility that you believe, potentially that this technology can be used for. It's not just about putting in the technology for one particular use case. When you're looking at developing or when you're looking at putting an RTLS solution together, we want to make sure that, and we certainly work with our partners and yourselves to make sure that we're actually we're future-proofing your RTLS deployment and future-proofing, what you're looking to do moving forward. So, look, again, I'd like to thank everybody who's been on the call. We don't have any other questions that we should answer, whilst we're on the call. But look, thank you everybody for attending. Really appreciate your time. Any questions, please reach out to your local reseller partner. If you're not too sure who's an Ekahau or AiRISTA RTLS partner, let us know. We'll certainly point you in the right direction. But again, thank you very much. Thank you, Bob, for your time. Really appreciate it. And look, good health to Dylan. Hopefully he recovers soon and we get him back on track. But thanks again, everybody, and enjoy the rest of the day.
Thank you.